Hi, my name's Randy Haun, and I work in the Department of Pharmaceutical Sciences in the College of Pharmacy here at UAMS. And research in my laboratory is focused on pancreatic cancer, which is a notoriously lethal disease. Even though the incidence of pancreatic cancer is not very high, it accounts for the fourth number of cancer-related deaths in the U.S. annually. Now, I'm sure you've all heard on the news or in the newspaper noteworthy figures who've died of pancreatic cancer, including Michael Landon, the actor Patrick Swayze, Pavarotti, the tenor, as well as recently Steve Jobs, the co-founder of Apple. But in addition to the famous people, I'm sure many of you have either had an aunt or a neighbor who you found out have been diagnosed with pancreatic cancer, and it turns out that they die of the disease within a few months. And unfortunately, this is the typical course of the disease. So there's several reasons that account for the high lethality of pancreatic cancer. The first is the disease is not diagnosed at a very early stage. And this is attributed partly because sometimes the symptoms for pancreatic cancer are relatively vague. A person may have abdominal pain, they may have weight loss, or they may have dull ache in the back, which comes and goes. Well, as you can imagine, if you had these symptoms, you wouldn't necessarily seek out physician assistance with such a vague symptom. The disease is already spread beyond the pancreas and is invaded into other tissues, which accounts for its lethality. So with lack of early diagnosis, oftentimes when a patient sees a physician, there's really little care that can be given other than palliative care. So the disease is not diagnosed early, and it's also very aggressive. And that means that the disease not only rapidly grows, but it also has the propensity to spread to other parts of the body in a process termed metastasis. And it's one of these features that we look at in the laboratory. So the reason that cells can spread throughout the body is that pancreatic cancer cells, as well as other types of cells, develop the attributes that they elaborate proteins termed proteases, which are proteins that can degrade other proteins. Now this is important because these proteins, there are proteins surrounding tissues as well as proteins that allow cells to adhere to each other, that once they're degraded by proteases, the cells can break away from the tissue of origin and spread throughout the body. So several years ago, we began to investigate the different types of proteases that are overexpressed in pancreatic cancer compared to normal pancreas. And in doing so, we observed that there's a particular protease termed Kallikrein 7, which is overexpressed in pancreatic cancer, but it's not expressed in normal pancreas. Kallikrein 7 belongs to a family of proteases termed kallikreins, which you may not be familiar with. However, one of the family members, Kallikrein 3, is also known as prostate-specific antigen, or PSA. And this you may have heard of because this is one of the biomarkers that's used for early detection of prostate cancer. Now, when we found that Kallikrein 7 was overexpressed in pancreatic cancer, we went back in the literature to see what was known about it. And as it turns out, Kallikrein 7 was described almost 20 years ago, and it is a normal protein produced in the skin. And so what is functioning in the skin is it is overexpressed in the outer layers of the skin, and it allows the outer layer of the skin to be shed, and this is what allows your layers, outer dermis, to come off and the new underlying layers of skin to grow. So this suggests that one of the functions of Kallikrein 7 is actually to break the adhesive structures between cells to allow in normal conditions your skin to slough off. But if it's overexpressed in pancreatic cancer, perhaps it allows the pancreatic cancers to slough off from their point of origin and spread throughout the body. We have used a number of investigative techniques to show that overexpression of Kallikrein 7 in pancreatic cancer cells can in fact allow those cells to migrate more frequently and to have less adhesion to other cell types. And this suggests that if you can inhibit either the activity of the protease through some type of an inhibitor, or if you can repress its expression in pancreatic cancer cells, that perhaps you can prevent the spread of the tumors throughout the body. Now, these types of intervention may not cure pancreatic cancer, but perhaps it could change it from being an acute, very lethal disease into a more chronic disease that could be managed by the clinician. So one of the other problems with pancreatic cancer is that there are currently no good therapies that can target either locally advanced or metastatic disease. Since almost 80% of patients who present with pancreatic cancer have locally advanced or metastatic disease, this also contributes to the lethality of the disease. So what we would like to do is come up with new therapies that can specifically target pancreatic cancer. Like most cancers, the chemotherapies that are typically used in the clinic target rapidly dividing cells. Although this is a hallmark of pancreatic cancer cells as well as other cancer cells, it is also a feature of normal cells, and this accounts for some of the side effects that patients often encounter when they take chemotherapeutics for cancer treatment. For example, hair follicles rapidly divide, and so people on systemic chemotherapies often have resulting hair loss. Patients can also have nausea or diarrhea caused from the killing off of the gastrointestinal lining. They can also become anemic by the loss of red blood cells, or they can have enhanced bleeding or bruising due to the loss of platelets. And these are because these are normally rapidly dividing cells in the body. So these agents, which target rapidly dividing cells, not only kill off the tumor cells, but they also have drastic side effects on the patient. So one of the other problems with pancreatic cancer is these chemotherapeutic agents aren't very effective in killing the tumor cells. So not only does the patient suffer the side effects of the chemotherapy agents, but they're not very effective in killing the tumor cells. Recently, more targeted therapies have been developed for other types of cancer, for example, breast cancer, in which they've been found that certain breast cancer cells overexpress a receptor called HER2. And chemotherapies can target specifically those cells that express this receptor. So what we'd like to do is to identify cell surface proteins residing on tumor cells that aren't on normal cells. So you can get the idea is if we have a pancreatic cancer cell which expresses a particular surface receptor adjacent to a normal cell which doesn't have that, if we can identify specifically what that target is, perhaps we can come up with interventions that will target this cell but not affect the adjacent normal pancreas cell. And so what we're currently doing is profiling the surface of pancreatic cancer cells to identify the various proteins that are expressed on the tumor cells but not on normal pancreas cells. With this knowledge, we may be able to target therapeutics specifically of the tumor cells and enhance not only the targeted therapy of tumor cells, but also reduce the consequences of side effects of systemic chemotherapy agents. I hope this overview has given you an appreciation for the types of research projects that are being conducted in my lab, and if you would like any further information, I would encourage you to contact me.